Hello everyone, so welcome to your Medicare Monday Medicare Update weekly update where I kind of talk about things that are on my mind and new things that came out in the world of Medicare and the world of health insurance. Three things I kind of wanted to talk about today. One is that the out-of-pocket prescription cost kind of report review came out, the Office of Inspector General report came out, and a new bill trying to make Medicare Advantage a little bit better for those people who are on those programs. First, the prescription drug thing. So on prescription drug programs, a lot of you folks know, who are my clients especially, know that while for those of you who don't take any medications, it is great. You can join a plan that's usually $10 or less and covers you for the bare necessities and maintenance medications. But for those of you who have brand name medications or medications that for whatever reason don't have good Medicare Part D coverage, you're looking at spending a lot of money. And in this kind of article, they talk about how when you're in a group medical plan or when you are with the employer plan, those folks who are under the age of 65 on the Affordable Care Act, that about 6 or 8% of people reach a notional amount of $500 per year of out-of-pocket prescription drug costs. And I would be one of those people. I spend less than my two prescriptions cost $10 times 12. Actually, times one of them is $5 every 3 months. One of them is $5 every month. So, I'm barely breaking even $100. Whereas some people on Medicare, roughly 16% of people on Medicare, spend $500 or more. And they break this down to the benefit structure of said plans, but it is a problem. I mean, more than $500 a year for people who are on a fixed budget does add up quickly, and with the more medicines required, 250 more medicines are being approved on Medicare program. The amount of medications that someone can be on is increasing rapidly. So they're saying, what can we do? And there's been talks about putting a cap on Medicare Part D. But as I said in videos prior, I mean, where's the money going to come from, right? There's almost no way to be sure, which is why I encourage everyone to first, of course, if you're my client, let me know if you get a new prescription. We can find ways or find other sources like GoodRx or Single Care or National Drug Card to see if it's cheaper without insurance. And of course, every year we will review your plan to make sure that the drugs that you're on are best covered in your Medicare Part D plan. Moving on to, of course, the wonderful Office of Inspector General. So this Office of Inspector General report comes out, I mean, I think the last one that I've been referencing constantly came out almost 5 years ago, I would say. And this month, April, they finally released their new findings. And it's great that they did, because almost 50% of people who are on Medicare are on one of these Medicare Advantage plans. About 41 or 42% of the Medicare beneficiary population are enrolled in a Medicare Advantage plan. And they have found that like I always say, prior authorization and the denial rates have been unfortunately higher than they would like. And what I'm talking about is that whenever you need a service, in the article here, they actually have from MedPage. In 2019, they did a study and they took a sample of 430 denials from a 1-week period from 15 of the largest MAOs, so that's Medicare Advantage organizations. And they denied prior authorization and payments that would have, in other terms, or if they're on original Medicare, would have met the Medicare coverage rules. So what they're saying is that of the denials that happened over just a 1-week period, 430 of these denials were wrongfully denied. And many of the, I guess you could call it, patients and physicians, the ones who are requesting these services that get the services denied, do not actually go and attest or try and overturn these denials. So this number, while yes, it is a small amount, 430 for a week, we're talking 30 million beneficiaries, it does not account for all the actual requests that were not appealed or appealed or try, when your doctor or yourself, you call the insurance company and say, why was this denied? Your physician does what's called a peer-to-peer, or they talk to a doctor. So that entire process of these denials, all of them were deemed coverable, or at least would have met what Medicare Part A and B would consider would meet the coverage rules. So what they're saying is, if this person, whoever these 430 denial services were, if they were just on original Medicare, they would have got the service done without a problem, wouldn't have been denied. So, again, my caution to everyone who is enrolled in a Medicare Advantage plan: make sure you are on the same page with your physician. Also, make sure that if you and your physician believe you need a service and it's denied, make sure you follow up, right? And find out whether or not it's properly denied. At this point, and people do tend to get kind of, I guess you could call it political, but it's just a matter of which program you're part of and understanding the rules of either side, right? For Medicare Advantage, you have to know that you are getting better rates when services are rendered, but you're also getting stricter guidelines for those rendered services. So just kind of be aware that you are going to have to work a little bit harder to get more expensive services covered. Now, I also talked about to my clients in a video that if you receive the email for the video, you are enrolled in one of the plans, but one of the Medicare Advantage plans actually removed quite a bit of the prior authorization requirements, and I believe it is because in this little excerpt, I'll link to all these articles and the actual Office of Inspector General report so you can check it out for yourself. But Medicare is actually intending on putting in steps if these so-called denied services would have been covered under the original Medicare coverage rules. The Medicare Advantage company could face penalties and also plan termination, which means that Medicare will not renew the contract for this Medicare Advantage company. So now more than ever, it is very important. Now more than ever sounds very cliche, but it is very important for those of you folks who have a Medicare Advantage plan or have friends on Medicare Advantage plans to let them know that they need to start really contesting anything that's denied. I believe in the old reports, I haven't checked the new numbers just yet because this came out literally this morning. I'm recording this on Friday to post on Monday, so it would have been last week the report came out. Hopefully I have more information throughout the weekend. But it says that most people, less than 1% of those claims denied, are actually appealed. So, you're going to have, if these denials come through, just call. Just call. I don't know what to say. No one knows what to say. Just do your best and try and fight for your right to get the service covered. Because many times the denials are, again, like it shows here, they are denied incorrectly. Incorrectly, unfairly, whatever word you want to use, they're denied and you deserve them. Next, one of the positive things for this video, and that is what's called the Improving Seniors Timely Access to Care Act of 2021. Now, I am not someone that follows Congress, at least things that are cooking, because I don't think anything cooking really can help you unless it is finished, written into law, and passed through Congress. So I look at things after they're kind of wrapped up, really, to make any kind of statement on it. So this thing is still cooking, unfortunately. But I believe it's very important, and if ever, again, I'll link to it in the description, in the email, and to the YouTube video here, but it is something that I have wanted very much that Medicare Advantage plans do, because I myself do not know when or if a client's service is going to be covered and how it will be covered. Medicare itself does establish guidelines for certain services that require prior authorization. Medicare Advantage companies, though, have a little asterisk and say that all of these services could require prior authorization. And then in the evidence of coverage, which is that maybe 400-page book that you guys get every year, for those of you folks who are in a plan like that, it doesn't really actually say what the coverage guidelines are. It just gives you a breakdown of what is considered XYZ service. So this little bill here, very short to read. I'll even read it word for word, okay? This bill establishes several requirements and standards relating to prior authorization processes under Medicare Advantage plans. Specifically, Medicare Advantage plans must 1. Establish an electronic prior authorization program that meets specific standards, including the ability to provide real-time decisions in response to requests for items and services that are routinely approved. So basically, it's a routine service, an X-ray because you have pain, or if it's an MRI because you have, you meet criteria. They want it to be an electronic process that can be kind of like an algorithm where, like, if you meet XYZ criteria, we don't have to talk to nobody, it just gets approved. Number 2, annually publish specific prior authorization information, including the percentage of requests approved and the average response time. So this is where you would have the company actually providing their kind of performance on, number 1, how much services that they are providing, right? Which is very important for health insurance. Like, if you're not providing services, what are you doing? And number 2, the time it takes. So for myself, for my clients, I require usually a 48-hour time to get back to you. And I leave it at that because I have many clients, I do videos like this, and I do a lot of research, and I want to make sure that I can provide the best answer for you. And I'm a one-man show, right? I will be editing this video, I'm recording this video. It's not like I have a team. But these Medicare Advantage companies, they're managing hundreds of thousands of lives, millions in fact. So their response time being immediate is quite important. And that's something that they need to start publishing if this bill passes. And I think that's very good, and it gives us at least beyond a anecdotal kind of a metric. Like for me, there's certain companies I know that don't answer the phone very often, or they do and then they hang up, disconnect, transfer all over the place. But as an agent, that's not something I could definitively say. Here we'll have definitive information. And of course, number 3, meet other standards as set by the Center for Medicare and Medicaid Services relating to the quality and timeliness of prior authorization determinations. So while yes, this is kind of looking at and saying, hey, Medicare Advantage companies, you need to do all these things. Honestly, in my head, I'm thinking, why aren't these things already there? And with all these new changes that are coming, I myself lean toward Medicare supplements as a starting point for people, and then we move on to Medicare Advantage if something about the plan or something about the extra benefits or something about the budget requires them to join said Medicare Advantage plan, or they have certain circumstances that will allow them to be kind of use the Medicare Advantage plan in a more flexible way, like if they have TRICARE or if they have other, federal retiree health benefit plans, or if they're, each circumstance is a little bit different. But this will be a huge win for Medicare beneficiaries when this thing comes out, and hopefully for all the agents out there who are helping Medicare Advantage members, it'll be a lot easier because we would have better, knowledge of, if someone joins this particular plan, how likely the prior authorization process will be. Prior authorization is never an enjoyable process, but how relatively quick and easy it will be by joining said Medicare Advantage plan. Because the Medicare Advantage plans, at the end of the day, are businesses. But right now, we are not given the proper metrics to measure them as companies that are providing a service. So it's really hard to give a good recommendation from an agent standpoint when you know all the moving factors. When you're looking at it from a kind of tunnel vision, XYZ, which one's better based on the benefits in the booklet, it's a little easier. But when you start, removing the tunnel vision blinders and seeing all the other stuff that goes along, like what I tend to focus on, it becomes very difficult. So hopefully this becomes law, and hopefully when I review the Office of Inspector General report, we can glean more information about how the plans have been performing. For those of you again on Medicare supplement plans, you don't really need to worry about this stuff. Just kind of keep it in the back of your mind, because if these programs do become more, I guess, look more like their original Medicare Part A and B counterparts, it might be the way that Medicare starts saving money, because Medicare A and B do not have service restrictions on them, which unfortunately is, well, yes, it does give Medicare beneficiaries a lot more access to care. It also opens the door for physician fraud. I'm not saying physicians have lots of fraud, but I do receive daily emails from the Hawaii, Health and Human Services, HHS.gov, which kind of show all the types of fraud that come through on Medicare and Medicaid, because when they're on those programs, because there is no real governing body that watches everything that goes through, there tends to be a lot of fraud on the physician side. So it is a balancing act. Again, there's three payers or three participants. There's the health care administrator, service provider, that's the physician, there's the patient, and then there's the insurance company. So when you remove one of those aspects, it kind of throws that whole triangle of accountability off. But I've been talking way too long. You guys have a great week, and I'll see you in the next video.